topic. So we have to be know nowadays. So ఇప్పుడు మనం కూడా ఏమవుతుందంటే rather than infectious disease నుంచి more of like a genetic disorders, behavioral disorders లో changes అవుతుంది because of infinity of hygiene అలా ఉండడం వల్ల infectious disease తక్కువ వచ్చింది. సో ఈ రోజు నేను మెయిన్గా డిస్కస్ చేయబోయే టాపిక్ ఏంటంటే సో వెన్ యూ సస్పెక్ట్ ADHD ఫుల్ ఫామ్ అంటే అటెన్షన్ డెఫిసిట్ హైపర్ యాక్టివిటీ డిసీజ్. సో వీ నో దట్ మోస్ట్లీ థింగ్ ఆఫ్టర్ కోవిడ్ తర్వాత మనం ఆటిజం ADHD మాటలు చాలా వింటున్నాము. దీనికి మల్టిపుల్ రీజన్స్ ఉన్నాయి. సో యాజ్ ఎ పేరెంట్ వాట్ షుడ్ యు నో అబౌట్ ద ADHD అండ్ how it is different from the hyperactivity. So normal child చేసుకుంటే some people are very dull, some people are active, some people are too much active. So today's this session main importance is how to differentiate normal hyperactive child compared to the attention deficit hyperactive disorder. So before going to the proper about ADHD, there is a little bit background if you know that around 19th century 1905 time they used to identify initially like they used to call ADD and attention deficit disorder. From last 1980s 90s they started using word like attention deficit hyperactive disorder. So but in our Indian setup we are seeing more from the like after 2010 2020 like that. So the main difference between the hyperactivity child and ADHD child is mainly three components. Along with hyperactivity, they have a inattentive and impulsive feel. If you label or if you suspect any child with ADHD, these three should be there. One is the hyperactivity, second one inattention. Inattention is lack of attention. ఎన్ని తెలుగులో చెప్పి ఏకాగ్రత లేకపోవడం. థర్డ్ వన్ లైక్ ఇంపల్సివ్. సో వై టు డిఫరెన్షియేట్ ఈ సెషన్ అయిన తర్వాత చాలా మంది దే విల్ థింక్ దట్ మై చైల్డ్ ఇస్ సో మచ్ ఆఫ్ హైపర్యాక్టివ్ ఈజ్ ADHD చైల్డ్ ఆర్ నార్మల్ చైల్డ్. సో టు క్లియర్ ఆల్ దిస్ డౌట్స్ టుడే ప్రొడ్యూస్ ద సెషన్. సో హౌ విల్ యూ మెయిన్లీ డిఫరెన్షియేట్ లైక్ ఎనర్జిక్ చైల్డ్ యాజ్ అ hyperactive child? If any child shows the following features in excess as per the age of the child in affecting the appropriate functioning of the child. This is important. So excess, so not like a routine thing, and the age of the child, that is very important. To 2 years child he cannot understand, so we cannot label him like ADHD child. So like the age appropriate. So 7 years child ki yes మనం చెప్తే కొంచెం అర్థమవుతుంది. అలాగా excess లో ఉండే activities, age of the child and affecting the appropriate functioning of the child. ఈ మూడు బిహేవియర్ వల్ల ప్రాపర్ ఫంక్షనింగ్ ఆఫ్ చైల్డ్ అంటే వెరీ పూర్ స్కూల్ పెర్ఫార్మెన్స్, ఆల్ దీస్ థింగ్స్ ఎగ్జాంపుల్. సో వాట్ ఆర్ ద మెయిన్ 6 ఫీచర్స్ దీస్ ఆర్ మీన్స్? ఫస్ట్ థింగ్ ఈస్ రెస్ట్లెస్ మూమెంట్స్ ఆఫ్ ద హ్యాండ్స్ అండ్ ఫీట్ అండ్ ఈ కెనాట్ స్టే స్టిల్. అంటే మనం ఒకసారి అంటే ఈ కుర్చీలో కూర్చోబెట్టి కూర్చోని లోపలికి వెళ్ళి వస్తారంటే ఇట్ డజంట్ సిట్, ఈ స్టాండ్ ఫ్రమ్ దేర్ గోయింగ్ హియర్ అండ్ హియర్. ద సేమ్ థింగ్ ఇన్ ద క్లాస్ రూమ్స్. And if you make him to sit one place, like మనం తెలియని వాళ్ళ ఇంటికి వెళ్ళినప్పుడు అయితే కనుక సో డెఫినెట్లీ సమ్ షైనెస్ వల్ల భయం వల్ల ఒక ప్లేస్లో నార్మల్గా కూర్చుంటాం. బట్ దిస్ ADHD children they won't sit like that. They will climb the sofas, they will climb the upstairs. They won't feel like that. It's like a new place ఉంది, ఇలా చేస్తే ఏమని అనుకుంటారా, it is a good or bad, they won't feel. And most important thing like a difficulty in following the rules of play activities. And the most another important part is like a talking excessively. They will speak continuously. మనం పిల్లలు ఏం చూస్తాం, లేదా వాళ్ళు మాట్లాడడానికి భయపడతారు. If they speak also they will answer whatever question you are asking. But these people are the talking compared to excessively. In detail if you compare it, I told inattention, impulsivity and hyperactivity. The initial told about the hyperactive things, that nothing but hyperactivity which is cannot be controlled. And the most important thing and the most dangerous to the children in ADHD because this impulsivity comes. What is impulsivity? This is nothing but tendency to do things suddenly without careful thought or planning. అంటే పర్టికులర్ ఏదైనా పని చేయాలంటే దే విల్ డూ వితౌట్ నోయింగ్ దట్ ఓకే ఈ పని చేయడం హార్మ్ అవుతుందా లేదా జరుగుతుందా, హౌ టు ప్లాన్. ఫర్ ఎగ్జాంపుల్ blurting out of the answer even before the question is completed. So if teacher is, or some other person want to ask, what is your school name? So, but these people don't wait till the completing of the question. What is your, and then they will tell, my name is Ramesh. So, because they blurting the answers till without completing the question. And often they have a difficulty awaiting turn. సో మనం ఏదైనా గేమ్ ఆడించిన లేదా ఒక 10 మంది 5 మెంబర్స్ 6 మెంబర్స్ పిల్లలు కూర్చొని పెట్టిన, ఫర్ ఎగ్జాంపుల్ బర్త్డే పార్టీ ఉంది, ఒక 20 మంది పిల్లలు ఉన్నారు, మనందరికీ చాక్లెట్ సమోసా ఇద్దాం అనుకుంటాం. సో లైన్ గా 1 ఇచ్చుకుంటాం కదా. ఈ పర్సన్ ఏడీహెచ్డీ ఇంపల్సివ్ పర్సన్ దే వోంట్ వెయిట్ టిల్ వాళ్ళు లాస్ట్ లైన్ లో కన్నా ఫస్ట్ చెప్పే వచ్చేస్తారు, ఐ వాంట్ టేక్. సో దిస్ ఇస్ ద ఇంపార్టెంట్ థింగ్. అండ్ దే డూ ద సమ్ సర్టెన్ థింగ్స్ వితౌట్ థింకింగ్ అవుట్కమ్స్ రిజల్ట్స్. అంటే ఫర్ ఎగ్జాంపుల్ కరెంట్ ప్లగ్ ఉంది, కరెంట్ షాక్ కొడుతుందని తెలిసిన వాళ్ళు వెయిట్ చేయరు, దే కరెంట్ షాక్ పెట్టేస్తారు. రెండు ఏంటంటే ఫైర్ ఉంది, మనం ఎన్నిసార్లు చెప్పినా యూ షుడ్ నాట్ టచ్ ఫైర్ అంటే దే విల్ గో టు టచ్ ఫైర్. అంటే ఆ ఇంపల్సివ్ ఎలా ఉంటుందంటే మనసులో ఏమనిపిస్తే దే విల్ డు దట్ థింగ్, దే వోంట్ బాదర్ అబౌట్ ద రిజల్ట్స్. ఇస్ ఇట్ గుడ్ థింగా, బ్యాడ్ థింగా, ఇస్ ఇట్ హార్మ్ మీ, ఆల్ దీస్ థింగ్స్. దిస్ ఇస్ ద another important point. And often interrupts the or introduced into others in a conversation and games. So one topics matter machine will do suddenly they will switch something without nowhere correlating the previous. This impulsive behavior is very very harm to the children, very very dangerous to the children. And this is inattentive feature of ADHD. This is the future. It's so common in the younger age group, school going children. So what is the inattention feature mainly to the, so it careless mistakes. Even our 4th class 5th class అయినా కూడా the mistakes ఎలా ఉంటే 2 and 3 అంటే 500. These are the careless mistakes. అంటే చూడగానే మనం ఏంటంటే ఏదైనా చదువులు నేర్చుకునేటప్పుడు కొన్నిసార్లు ఇది ప్రాపర్గా నేర్చుకోలేదా, లేదా నేర్చుకొని కేర్లెస్ మిస్టేక్ చేస్తున్నాడంటే దిస్ ఇస్ మోర్ ఆఫ్ కేర్లెస్ మిస్టేక్స్. సెకండ్ వన్ ఈస్ ద డిఫికల్టీ సస్టైన్ అటెన్షన్. ఎక్కడో మనకు 1 కిలోమీటర్ దూరంలో బాంబు వెళ్ళినా ఇక్కడ చదువుకుని లేచుకుని కూర్చుంటాడు. అంటే ఆల్వేస్ ఈస్ థాట్స్ ఇన్ ఏ ఫ్లయింగ్ మోడ్. సో యూ థింక్ సమ్వేర్ అంటే పుస్తకం పట్టుకుని కూర్చుంటాడు కానీ యూ థింక్ సమ్వేర్ ఎల్స్. అండ్ when we are trying to speak with him, he never give the eye to eye contact. If you speak with him, you will see somewhere else. And does not follow instructions, especially homework and the school work. This is the one of the most important thing any parents can identify early in the, if you suspect child ADHD. Almost in 1 week lo utrosu kuda correct time homework cheyaru, and they will very much neglect the homework if you do very very silly mistakes. And another important thing ఏంటంటే ఈజీలీ లాస్టింగ్ ఆఫ్ థాట్స్, ఈజీ లాస్టింగ్ ఆఫ్ థింగ్స్. వాళ్ళ దగ్గర మ్యాక్సిమం నెలలో 5-6 సార్లు వాటర్ స్కూల్లో మర్చిపోతుంటారు. మనం చూస్తూ ఉంటాం రీల్స్ వీఆర్ సెయింగ్. సో వన్ చైల్డ్ ఈస్ ఎవ్రీ టైమ్ షీజ్ ఏ లాస్టింగ్ ఎ వాటర్ బాటిల్, అండ్ మదర్ ఏమో ఒక కవర్లో వాటర్ కట్టిస్తుంది. సేమ్ థింగ్ లైక్ దట్. పెన్సిల్స్, పెన్స్, ఎరేజర్స్, ఆల్మోస్ట్ ఆల్ ఆల్టర్నేటివ్ దే యూస్ టు గో ఫర్ షాప్. సమ్ విచ్ ఆర్ యూజువల్లీ థింగ్స్ విచ్ ఆర్ child usually lost and often forgetful in the daily activities. Especially in that they will go directly to the bathroom and brush చేయడం మర్చిపోయి they will go for the bath. లేదా సాక్స్ వేసుకోవడం మర్చిపోయి షూస్ వేసుకుంటారు. కొన్నిసార్లు ఇప్పుడు ఇంట్లో either స్కూల్ బ్యాగ్ కానీ లేదా లంచ్ బాక్స్ సంథింగ్ they will forget it. So these are the inattentive features. So why I am telling these are the only things as a parents you can identify. So 3 points like ADHD, attention deficit, hyperactivity disorder. And these 3 common things are the, one is the inattention. Their inattention is too much, they do very silly mistakes, easily lost all the things what they have, easily distractible. Even pakkani TV lo chinna sound vachina they will easily distract అయిపోతారు. And second one is the impulsive. I told that impulsive they will do the things without knowing the proper knowledge and how it will end up, they don't know. If there something happen in their mind, they will do it. It's good or bad, they won't think. And I told initially like a hyperactivity. Hyperactiveness, they never wait for their time. So if you see in all these 3 scenarios, one at the school, like inattention component hyperactivity. Another one is the community. Third one is the at home. If any child has three futures, two out of the three occasions, like school, community, like other friends తో కూర్చుని కానీ లేదా at home. Two out of the three areas లో these symptoms ఉంటే then we can suspect the ADHD. ఎందుకు చెప్తున్నానంటే some children are very naughty at home, but when they are going outside, they behave like very smartly. They are very good at school performance. Then you never think about their ADHD. These are children only hyperactive children, because remaining two situations they are so normal. ఈ ADHD children ఎలా ఉంటారంటే వాడు బయటికి వెళ్తున్నాడంటే పేరెంట్స్ భయం, ఎవరిని కొట్టొస్తాడో ఎవరిని తిట్టొస్తాడో పక్కింటి కంప్లైంట్స్ వస్తాయి. పేరెంట్స్ టీచింగ్ మీటింగ్ అవుతుందంటే పేరెంట్స్ భయం, స్కూల్ నుంచి ఏం కంప్లైంట్స్ వస్తాయో వాళ్ళు ఏం చెప్తారు. ఓకే, దట్స్ ద థింగ్. సో my child concentrate very well if he wants to, but how can the child has inattentive or hyperactive? This is the point you have to know, that if child demonstrates the hyperactivity, intense inattention, hyperactivity, two or more settings, and is affecting the functioning and the performance of the child. So again I'm telling, but after listening, don't so much of tense. The main purpose of this session is that if you identify your child as any of these features, meet your pediatrician or psychiatrist. Rather than don't think like that all these things are there in my child or not. Okay, this is another important point. Coming to this, what should I do if I suspect inattentive or hyperactive? So don't ignore early warning signs, because so this ADHD component you will see between the usually school going children or early school, like 4 years, 5 years, we can apply up to 12 years. During this time, from 4 to 12 years, this time, neuroplasticity, it means the neurons, what are there in the brain, by doing some therapies, by managing skills, we can modify that pathway. So if you identify these are early, if you can give some therapy, they will respond. So that's why don't ignore early signs to take your concerns and experts. Okay, main thing is the lifestyle modifications. Lifestyle modification, main important point is that you avoid the screen time. That is an important thing. Once they come out of the screen time, when they are going to the people, they know what is the socialization. What's the time outside more with other people, they know what is good, what is bad. So socialization will have screen time. Now we are seeing like a double screen time, triple screen time, like things. Double screen time means, so one side movie is coming or something coming in the TVs, in the things that they use the mobile. So screen time is a very, very bad. Second one is the more sleeping. So child should be sleep, at least he has to be sleep for 9 to 11 hours. So quality sleep every time is important. And third one is a fixed routine. It's not like a making the discipline, fixed routine. So morning he has to wake up 6 o'clock. After 6 o'clock he has to go for the basic needs up to 7 o'clock. 7 o'clock he has to finish the 7:30 or the breakfast. So like that, if you keep like fixed thing, it will be in a proper direction. Fourth one, decreases sugar foods. Some studies are showing that sugar foods have some extra decrease discipline. So all these things you have to be do. Definitely you can see that some improvement of these doing things. And is there any test to diagnosis? So after telling that, is there any test to diagnosis? So majority of these behavioral disorders like ADHD, autism, all these things like that, not like any blood test or any MRI scanning or any other things are not useful. So there are the autism diagnostic criteria points will be there. For example, some points of inattention, some points of hyperactivity, some points of impulsivity there, we have to take this one. So usually now they are following like a DSM-5 criteria. But the point you have to understand is here, some comorbid conditions like anemia or other some metabolic diseases, they can present like a ADHD. So that is important to that disease should be ruled out. We rule out any medical condition that explains the feature of ADHD, and then final years can be made by the DSM-5 criteria. Yes. So sir, you are telling like ADHD is there. If it is, do the features of ADHD become better with age? And can ADHD be completely cured? Can the child become normal? This is a common thing in the everyone's mother's mind is there. So you are telling ADHD. So we are talking up to 12 years. Is it better with the age or not? So now we are seeing that some adult ADHD disease also. So this adult ADHD diseases, so mainly seen in the like other stresses. So if you take that, what will happen with age? So these ADHD components, majority of the hyperactivity will improve with the age gradually. So what is the child hyperactive part is there? No. So they have definitely improved with the gradually. But the impulsivity behavior becomes problematic mainly in the adolescents. So as become adolescent, they have impulsivity. So simple thing is if you see that if you have a bike like car we have, we'll have tried to go into like a beyond certain limit of speed, like 100 or 120, whatever it may be. But these people they have impulsivity. They don't know that okay, if I cross some certain limit of the speed that will dangerous to the life, like they didn't do. And that inattention is a common in the school age children. So inattention part slowly improve, hyperactivity part is a slowly improve. But that impulsivity becomes the more problematic in the mainly in the adolescent groups. So the therapy essentially consists of behavioral therapy. So by doing the behavioral therapy and some medicines. Behavioral therapy alone cannot do full-fledged and medicines alone do wonders. So when combination of these things, the therapy essentially behavioral therapy and medication if anything is required. This medication also not taken by the parents individually. They have to consult the doctor. With behavioral therapy and medications, definitely child will get better, child will get improved. Again, I am telling, if you suspect, take to the your pediatrician and the child psychiatrist. If that's normal, everything is happy. If that is abnormal, how early we give the any this type of treatment, the child response will be very much good. So that is the more important point. You have to be understand. So these main myths and facts, whatever the new disease coming like that, whatever the new thing coming into the circulation, there are n number of myths more than the what are the truths. So first myth is the ADHD means a naughty or badly behaved child. So initially I told there is a significant difference between the naughty and the ADHD child. So if naughty children, they are doing voluntarily. So if you are controlled, it can be controlled. But these children is the it's a neurodevelopmental condition that affects the attention, impulse control, activity things. This is the problem they have. They are not doing voluntarily. And the most important thing, like a poor parents causes ADHD. Another myth is there. Now they are telling that especially grandparents or people who are best child behavior, మీరు పిల్లలు పట్టించుకోలేదు అందుకే మీ పిల్లడు ADHD అయిపోయింది. But the avoidable things like screen time, all this should be avoided. But there is nowhere related to parenting. Parenting does not cause ADHD. However, structured parenting strategies can help manage the symptoms. What I told initially, screen time content changing, fixed programs, like a morning eat and chair, listening, ala cheyadam is useful. But poor parenting never causes ADHD. This one, children will automatically outgrow ADHD. ఏముందిలేరా నాలో వదిలేసే స్లోగా ఇంప్రూవ్ అయిపోతుంది కంగారు పడకండి. దట్ ఇస్ ద 100% myth. Some symptoms may improve with age. What I told, if you see previously, like a hyperactivity will be better, inattention can be better, but impulsivity will be worse. Same thing. Some symptoms may improve with age, but many children continue to need support into adolescence in the adulthood. So that inattention hyperactive can be better, but without proper interventions, the impulse will be never become normal. And fourth, children with ADHD are not intelligent. So nowhere related to intelligence. ADHD is not related to intelligence. So ADHD is not related to intelligence. Many children with ADHD are bright, creative, and talented. There are a few scientists are there. They have a ADHD patients and a few very good positions to have the ADHD. And fifth one is ADHD caused by too much screen time or sugar. So again, I told previously, screen time or sugar may worsen the behavior in some children, but they do not cause ADHD. But avoid doing these things. So these are the main myths. Coming to next myths, ADHD only affects the boys. It's a very truth. So ADHD can affect the both boys and the girls. And if you know the incidents, definitely you will feel a little bit afraid. Every one of the every one of 10 children, every one of the 10 children has the ADHD symptoms. If you see like a average now, every class has like a 40, 50 people, it means 4 to 5 people are ADHD in the every classroom. So girls have ADHD, but it will present it differently. They have more of initiative symptoms. Girls have the more of initiative symptoms. Why girls are initiative symptoms? Why boys are hyperactive? It's like a genetically mediated. So they don't have hyperactivity or impulsivity. They more of initiative symptoms. So if any girls who are doing like a very poor academics, if you in detail you can observe there is a chance of the ADHD in the girls. And this one, ADHD medication is always harmful or addictive. This is again big myth. As I told that ADHD can be managed with the support of the behavioral therapy along with the some drugs. When prescribed and monitored properly, medications can be safe, effective for many children. And a child with ADHD just needs the more discipline. See, it's not like that. ADHD regular requires understanding, behavioral strategy, and school support, and sometimes medical treatment. It's not like a punishment. So for like that, doing like discipline, like when people, children don't they have discipline, parents they have to do like a positive reinforcement or negative reinforcement. So negative reinforcement పిల్లలకి కొట్టడం కానీ తిట్టడం కానీ భయపెట్టడం డార్క్లో పెట్టడం. Whereas positive reinforcement అంటే so they used to give praise them, they used to give the gifts, all these things. But child with ADHD doesn't not because of lack of discipline. They have some issues. There's a neurohumoral issues. Main neurohumoral issues ఏంటంటే ADHD లో. So మనం థింక్ చేసేటప్పుడు బేసిక్ థింగ్ ఏంటంటే మన డెవలపింగ్ బ్రెయిన్ we have the neural connections and the neural modulations. Neural connections అంటే connections between the one neuron to another neuron. Neuron అంటే nothing but the part of the nerve. మన నాడిలో ఉండే దాంట్లో ఒక part లో neuron అంటారు. These connections because of between of the some secretions will be there. That is called neuromodulators. ఆ secretions ఈ neural connections దీని ఎఫెక్ట్ వల్ల ఎఫెక్ట్ అయ్యేది ADHD. ఇట్స్ నాట్ లైక్ ఎక్స్టర్నల్ థింగ్. మన ఎక్కువ భయపెట్టడం వల్ల లేకపోతే ఎక్కువగా అన్ని దగ్గరగా చార్జ్ తీసుకొని నెమ్మదిగా చెప్పడం అవ్వదు. దిస్ ఇస్ సమ్ అబ్నార్మల్ ఇష్యూ. బట్ అన్ఫార్చునేట్లీ దీస్ న్యూరలాజికల్ ఇష్యూస్ వీ కెనాట్ సీ లైక్ స్కాన్ MRI స్కాన్ లో కనబడడం బ్లడ్ టెస్ట్ లో కనబడడం తెలియదు. అండ్ last point, ADHD is there. As I told that it's not at all there. One of the most common neurodevelopmental conditions in children. It is almost like more than 10-50 times than the autism children. So now everywhere we are educating because of the autism by the this one social media, all these things. Early help is unnecessary. Initially I told early identification support can significantly improve the academic, social and the outcomes. I told now 3 to 12 years. This is the ideal time. That time is the neuronal plasticity will be there. Neuronal plasticity means that time neurons are mutual growing. We can model whatever direction it is going on that. This is important. Can he go to school normally as others? It is deadly myth. These things cannot get better or the child has ADHD. That is a timely and regular interventions can make a significant difference. If you give proper influence, like a proper intervention, you do like behavioral therapy, all these things, definitely they will get better and they will improve. So again, I'm telling that early recognition, support and understanding make a difference. Understand their problem and try to understand their issues and support them and empower them. Not only one person, like a mother or father, all family members, along with teachers, along with the pediatrician, along with the doctor, then they definitely they will thrive. So it is like a neurohumoral issue. It is not like a structural cause and a brain and a cry not a metabolic cause. Some other things are there. And one point I am telling that you have to take your child when you are suspecting ADHD, either child psychiatrist or the pediatrician, because we can identify some genetic diseases associated with ADHD. So these are the number of other parts are associated with ADHD, like specific learning disorder, dyslexia, and other associated comorbid conditions will be associated. If these are associated with ADHD and associated with other diseases, there is a more chance of like a genetic syndromes will be there. And as I told initially, we should see the some comorbids will be there. Anemia, behavioral issues, they can be treated, they can be addressed. The point is, I told initially, if you suspect anything, all these things, when our child is a very poor school performance and is doing very silly mistakes, even fifth class, fourth class also now కూడా 2 into 26 అని చెప్తాం కానీ ఈజ్ ఈజీలీ లాసింగ్ ఆల్ ఆబ్జెక్ట్స్ లైక్ వాటర్ బాటిల్ బుక్స్ పెన్ అన్ని లాస్ చేస్తున్నారు అండ్ దర్ ఇస్ మోర్ ఆఫ్ ఫర్గెటింగ్ ఈజీ థింగ్స్ బట్ అండ్ స్ట్రిక్చర్డ్ మేనర్ లేకుండా అది చెప్పాను కదా బ్రష్ చేయకుండా బాత్రూమ్ స్నానానికి వెళ్ళిపోవడం కానీ లేదా షూస్ సాక్స్ వేసుకోకుండా షూస్ వేసుకోవడం కానీ ఇవన్నీ ఇట్లా ఏజ్ అప్రాపరేట్ థింగ్ అట్లీస్ట్ మనం 2 years పిల్లలు ఏంటంటే ఈ కెన్ వీర్ ద షూస్ వితౌట్ వీరింగ్ ద సాక్స్ యూ కెనాట్ సస్పెక్ట్ ADHD children. And the most important thing is these things when parents are complaining so much and we have a colleagues on apartments on the gated community, everyone is complaining about child. And if you feel like your child is hyperactivity, don't feel shy and don't think that these are normal. Try to meet corresponding person as soon as possible. If support them, the results will be definitely very good. Thank you all. Is there any coaches? My child is always running, shouting, and does not sit even for meals. Should I be worried or is this normal? So the same thing I'm telling that if the same thing happened when you're going to relatives' house and same thing happened in the school. So maybe some kids are don't bother about their parents doing all these things, not to be worried. Rather than at one place, if the child has this symptom remaining at 2 places, definitely have to be think about there is a chance of ADHD. At what age should we start worrying about hyperactive children? Usually 4 to 50 years. So ADHD is the problem of school-going children, not like a normal children like earlier that I told age appropriate. So 2-year child, 3-year child, we should not expect so much of structured plan. At the same time, 7-year child has to do all the things. So school-going children are the one of the common thing. If you identify all these 4 to 5 years children, yes, you can suspect about all these things. What are early warning signs that parents usually ignore? Say this is the things. So he doesn't bother about the things what he is doing. Is doing good thing or bad thing like impulsivity things like a fire touch and throwing of the objects without like the about the poor, very poor academics and a very common school mistakes in the classroom low. అది చేస్తూ ఉండడం ఈజీలీ ఫర్గెటింగ్ అవుట్ సైడ్ థింగ్స్ ఏం తీసుకెళ్ళి బయట మర్చిపోవడం ఆల్ దీస్ థింగ్స్ ఉంటే డెఫినెట్లీ హ్యావ్ టు బి వరీయింగ్ అబౌట్ యువర్ చైల్డ్ మేబీ ADHD చైల్డ్. Do sugary food really make children more hyperactive? Yes, some people are telling not only whether hyperactive or not, try to avoid the sugary foods. That's a good for the baby. I told 2 things, screening time and sugary foods. These may not directly cause ADHD, but definitely they make worsen the symptoms of the ADHD. It's better to avoid the sugary foods and the screen time. If it is ADHD, will my child be normal in future? So as I told, initially I told, definitely there is chance of improvement, but it won't come by with ignoring the child or leaving the child or punishing the child. The results will come good with proper cognitive behavioral therapy and the proper some use of the medications. So definitely medication is required. As I told that the medication has to be prescribed with a proper qualified person. Definitely medication is giving that he will get the better. Especially that the hyperactivity component will be controlled by using the proper medication. How can I build child confidence despite hyperactivity? So the confidence mostly will come by the when he's doing the your guidance, if he's doing the good thing. So when you are like a hyperactivity child, what I told him, he never wait for his turn. He used to go and doing all these things. So usually if you do like that, people will scold him. So why are you not waiting for your turn? Why are you interfering in between? Why are you coming in between like that? When you tell them, so better you should wait till your turn kind. Like means you have to tell them you wait unless they ask you what are doing like that. If they do like that, people stop scolding him. People stop doing like a bad things. Then he will get the more confidence in him. So being with him and telling the advantage of the not doing that thing, that particularly they will get the confidence. So I think all questions are over. Thank you. Thank you for listening properly. So we have our developmental pediatrician at Hyderabad Lotus Hospital, and if you definitely you can take our seek our help. If anything, we will do it after. And wiser, if you anyone have a, like these are the issues, definitely you can come to our hospital, use our services. Thank you.